Now we wait. Hey everybody, happy Friday. Hope you guys had a great week. We've been very busy around the system with the surgeries getting back up, starting to see people more in our clinics now in person instead of face-to-face for the telehealth visits. But we've actually been not so busy in another aspect, which is our stats. So tell us a little bit about that.
Yep, we are very happy to report today that we had 0 positives. We did have 1 yesterday, but we've had, our days have went, we had 0, 2, 0, 1, 0, 1, 0, 1, 0. So that's the last 7 days. And so very happy about that. And it's testament to the community and everybody working hard,
Yes.
Try to stay safe and do the normal things, hand washing and not touching your face and whatnot. But I'll give you some other stats for today. So to date, through today, we've had 3,190 tests done, a lot. We've had 223 positives. Unfortunately, the worst part of this whole pandemic, there are 13 people that did lose the battle with COVID-19, but we've had 210 survivors. We've had 58 people that have come in and been through the process through either the ICU or med-surg floor that have been discharged. We got
Don't stop believing.
Got to play Don't Stop Believing 58 times, so that's really good. We've had over 8,000 telehealth visits. Right now, we've got 10 people still in the hospital, 4 in the ICU, and 6 on the med-surg floor. So we're hoping that we'll get to play that 10 more times and not have too many more positives that are inpatient from here on out. So as you said, we're sort of on the downhill slope, and we're pretty happy about that. And then the biggest number that I'm happy to always report is our 2,500 heroes, people that have been still working very hard, and the fearless warriors. So anyway, we're looking forward to recognizing them next week.
Yes, next week is National Hospital Week, and COVID's not going to slow our team down. We've planned some social events that are physically distancing ourselves. So we'll be getting together, but taking our precautions this year. So we're looking forward to that, to celebrate them more than ever this year for sure.
Yep,
and
definitely.
We know with the restaurants and bars opening back up this week, and I heard that the salons are going to now open on Monday. So after this rainy day today, I'm kind of over it, so I'm ready for a haircut. But we're all big proponents to get back to business as usual and to be able to go out and see our friends and to partake in the economy. And so we have decided to put together some more resources on our website to kind of help guide you all through, properly and safely going about reentering society. And first is going to be the guidance for cleaning and disinfecting. So this cannot just be for restaurants or for places of business, but for your homes, just to properly clean. And then with face masks, if you are working with the public and seeing strangers every day, you probably are going to be told to be
so many questions on face masks, so it's good.
So literally this little diagram of
help you
properly how to wear them.
SingingRiverHealthSystem.com.
Yes, for
Sarah's got it all out there, everything you need to know.
Right,
keep you straight.
Go to the homepage, click on the coronavirus bar at the top. You'll see the list of pages on the side, and you just push resources, and they're all downloadable for you to print.
Speaking of businesses opening up, we are Sarah's right. We are ready for businesses to open up and get our economy back going again. But someone asked me about our stats, and so I thought I'd share that today too. We've been down this month. We were down about 30% in admissions, and that's just like every other business, we depend on that to be able to stay afloat, and so. We're hoping that things get back to normal. Our surgeries were down about 25%. The only types of surgeries that we were doing were the ones that were emergent. A few stats were up. Our deliveries are actually up 3%. So and a lot of babies born during this time, which is tough when you have the limited visitor policy. We understand that. Another reason we're ready to try to, we want to get things back to normal.
Everybody who's been very patient with us.
Absolutely. But other areas, behavioral health, mental health issues have been tough right now. So that's been up. And some of our service lines with telehealth visits and other things have been up. Rheumatology and endocrinology have been up. But for the most part, we've been down. We're ready to get back to normal also. So we're hoping that'll get rolling soon. One other statistic that people have asked me about is how do you know how many people have recovered? Well, if you live through it, you're going to recover. You're a survivor. So but and how many people are out there that have it. So as I mentioned, we've had 223 positives. And the way we look at it, and the way I think most world looks at it, if you've been had no symptoms for about 14 days, that segment of people you can take and multiply times a depends on your area and all kinds of factors. But for us, it looks like it's around 3.5. So based on the people that have passed that 14-day window, it looks like there's probably about 200 people out there in our community that probably are positive. So you still need to be very careful because there still could be many people out there that you interact with that could be a positive. So stay focused would be my message there.
And while you're trying to decide, your Mother's Day plans, many of us have, older women that we love. And so we want to make sure that we protect them.
Happy Mother's Day, Mom.
So we also have another resource on that page to try to, help you navigate whether or not you should see your loved one in person based off of their, health history and what kind of things they're dealing with. Be
careful, you guys. There was a spike during Easter, right after Easter, and that's because a few people visited that probably shouldn't have. So out of respect, I'm going to FaceTime my mom, and I would suggest you do the same. And just in case, out of abundance of precaution, try to, remember what our sign says, stop the visiting. So I think we just need to try to continue that a little longer and let the businesses and other things get rolling. So
exactly. Let's do this so we can be successful.
Oh, and I have one more stat, the most important
one.
Speaking of safety, here's our framed A, which we're very excited about. And we've got one at both facilities, Pascagoula and Ocean Springs. That's an A by the Leapfrog Group. We announced it last Friday in patient safety. The most important thing, there are very few hospitals in the nation that achieve the A. It's like the holy grail of patient safety. So again, a big shout out to our quality and infection prevention team, the doctors and nurses and technicians and everybody on the clinical side who work so hard to make sure that we are safe and clean. But very proud of the A, and congratulations to all our team members for an A in both Pascagoula and Ocean Springs.
Right. Super excited about that. That should tell you all, the public, that it is safe to come and see us, to make your doctor visits and get those surgeries that you maybe been waiting on, and come see us because we're safe.
We are. And I think you had one more thing.
All right. So I think you've kind of been into the whole musical theme with us. And as Lee says, everything's going to be all right. We've made a video with some of our team members to that song, just to try to, lift our spirits as we're coming through the tunnel out of this. And also we created.
You're going to put that on there today?
Yes, I'm going to post that tonight once we get off here. And with that, we also have some playlists. We call it the Singing River Story. And it kind of started when we first kind of were going into this, what we're feeling and, some of the lows and the highs. And so there's music on Spotify and Apple. We made a playlist on both of those platforms that we'll also be sharing.
Starts out a little tough. At the beginning, it was won't back down and stuff like that.
Don't stand too close to me.
It was don't stand. Every breath you take. What was the Celine Dion one?
Alone.
So and then we migrated, and now we're more symphony and things like that. So it's a great
pump up songs there too, to make we're ready to fight this virus, and we did. So we're very excited to share that with y'all as well. And
check it out on Facebook and share, so people will know what's going on, and they can point to all the information that Sarah gets out there. When you share with your friends, they can see all the stuff that she does. So share and ask your friends to. Invite your friends to like us on Facebook, so they have all the info.
Singing River Story, it's called.
Cool.
Stay Singing River Strong.
All right. Stay Singing River Strong.
Have a good weekend, guys.
Appreciate it.